guys, it's Carissa. I wanted to talk to you today about miscarriage prevention and the symptoms of a miscarriage. Obviously, us TTCers know how much effort it takes to conceive and just to get the baby in there. Some people have been trying to conceive forever and some people just started trying to conceive, but it's equally important once you finally do conceive to be able to maintain your pregnancy. 1 in 5 women have a miscarriage in their lifetime, and sometimes miscarriages are preventable and sometimes they are inevitable, meaning there is absolutely nothing that you can do to prevent a miscarriage, including a chromosomal abnormality. So I was told that a chromosomal abnormality was the cause of my miscarriage, and that brought up a lot of questions. Is that kind of a blanket statement that people use just to make you feel better? Like it was something, chromosomally wrong, so it wasn't your fault? And I found that the answer is no. A chromosomal abnormality is something that is completely unpreventable. It's where either the egg was damaged before it met the sperm was damaged before it met the egg, something went wrong in fertilization, or something went wrong in implantation. And all 4 of those reasons can cause you to have a miscarriage and are completely unpreventable. So now let's talk about the things that are preventable. Obviously, you want your pregnancy as low risk as possible, and thankfully there are a lot of things that you can do to make sure that your pregnancy is low risk and that the baby stays in as long as possible and is as healthy as possible. Step number 1 is prenatal care. You definitely want to know where you're at health-wise and get any type of health problems under control if you have them, like lupus, high blood pressure, diabetes, kidney or heart diseases, any type of STDs, anything like that. You definitely want to get under control to decrease your chances of miscarriage. Number 2, smoking and doing drugs. This is kind of a no-brainer that if this does damage to you, it's definitely going to be doing damage to your baby. Women that smoke and do drugs cut off the air supply to their baby, which not only causes brain damage, it also causes birth defects, and they are 3 times more likely to have a miscarriage. So if you are a smoker, it's time to stop now. Number 3, drinking alcohol. This is obviously something that is a concern for many women, and some women think that it is okay, but I think it's better to stay on the safe side, especially in your first trimester. Also, you don't want your child, if it is born, to end up with fetal alcohol syndrome. Number 4, exercise regularly. Exercise is important for our overall health, but it's especially important when you're pregnant. You want to focus on keeping exercise light. Doing yoga or walking or swimming. Keeping your heart rate below 150 beats per minute will decrease your chances of a miscarriage. Number 5, maintain a healthy weight. If your body mass index, BMI, is lower than 18.5 or higher than 30, meaning that you're underweight or overweight, you have increased chances of a miscarriage. So you'll want to change your diet and exercise. Just make sure that you stay in between the 18.5 to 24.9. That is ideal. Number 6, you should be taking a prenatal vitamin every day, mainly so you can get your folic acid intake. Folic acid helps with the baby's development, especially in early pregnancy. And one of the reasons for miscarriage is that the baby stops developing. This can help prevent that. Number 7, limit your caffeine intake. If you are a coffee lover, this one will be hard for you, but it will be worth it. Studies show that women that have over 200 milligrams of caffeine per day increase their chances of miscarriage by 50%. So if you are a coffee drinker, it might be time to switch to decaf or tea. Number 8, be careful what you eat. You don't want to eat things that have a lot of bacteria in them because at this stage in the first trimester, when the majority of miscarriages happen, the baby cannot fight off the bacteria caused by things like soft cheeses or deli meats or raw sushi. So be careful what you eat. Number 9, decrease your stress levels. Stress is a really hard thing on the baby all throughout the pregnancy, and it's one of the biggest things that can cause miscarriage. Obviously, stress is inevitable in our lives, but we can do things like yoga, meditation, going on walks, listening to soft music, things that calm our minds, and this will help prevent miscarriages. Number 10, ask your doctor about sex. Depending on how high risk your pregnancy is, sex may or may not be okay. Having an orgasm may or may not be okay. These, surprisingly, are two things that can cause miscarriage, but not in all cases. Number 11, be cautious about over-the-counter drugs and prescriptions. This is something that you'll also want to talk to your doctor about. I know things like Advil and Motrin can interfere with implantation and cause miscarriage, and there are a bunch of other over-the-counter drugs that you'll want to watch out for. This is something to Google and do your research about. Number 12, avoid contact sports, weightlifting, and anything that can make you fall. Obviously, anything that impales your stomach is likely to cause a miscarriage, so be careful with yourself, especially in the first trimester. Number 13, pay attention to warning signs. Bleeding, fever, really sharp cramping, these things can be signs of a miscarriage. So if something like this occurs to you, tell your doctor about it. And if your doctor puts you on bed rest, take that very seriously. That's a really good way to prevent a miscarriage. Last, I want to talk to you guys about miscarriage symptoms and what to look for when you're having a miscarriage. The most common one is bleeding, and that's when your bleeding goes from spotting to light to very heavy very quickly. Then you know that you're having a miscarriage. Usually if you are bleeding as much or more than the heaviest day of your period, you just know and you have a gut instinct that you're having a miscarriage. 50% of women, however, who have that heavy bleeding do not end up having a miscarriage. So you have about a 50-50 chance. The other symptoms can include fever, lightheadedness, dizziness, feeling really weak, having really sharp abdominal pains, or having really sharp back pains. If you have any of these things happen, you'll want to call your doctor as soon as possible. Sometimes there are things that they can do about it, and majority of the times there are not. So that's it for today. I hope this video has been informative. I'm sorry about the lighting. I have been videoing this over like a 20-minute time frame, and the sun is setting quickly. But I want to thank you for watching my video, and hopefully it has helped somebody out there to prevent a miscarriage and kind of recognize the symptoms if they are having one. Thank you for watching my video. Subscribe if you'd like to, and I will come out with another video soon. I'll see you guys later. Bye.